Heartfelt sympathies are with him and the family who have put in a lot of effort and time into this process. And what gives us hope is even when this decision was mentioned to him that his hand had to come out, he said, "Doc, when are you putting the next one on?" I mean, that gives us hope. And to our knowledge, this is the first instance where in the first year of transplant, in a compliant patient who has taken all his medications properly and all his drug levels were running within the normal range, this is the first instance where such an incident has happened. To our knowledge, in the experience of the world, the world experience of hand transplantation, there has been no hand transplant lost in compliant patients, that is, patients who have been very compliant with their medications. Nobody has lost a hand transplant graft. This, unfortunately, is the first instance which has happened. The other grafts that have been lost have been mainly to do with non-compliance or non-availability of drugs in different parts of the world. It changes our perspective about what were the established conventional features of rejection we need to look for, or features in hand transplantation. Typically, we were going the established known features of rejection or problem with a hand transplanted limb were swelling, appearance of rash. Those would be those would set off signals that something was going on. Dave did not have any of that. He never had swelling of his limb. He did not have any rash. Till he did complain of some pain in his limb for a few months, in the last couple of months. And this came, the discoloration of skin that subsequently followed came on suddenly, and this was a totally new experience for all of us, and we do not find a parallel in world literature so far. So we do not have all the answers. As Dr. Breidenbach was discussing before, whether this was purely a mechanical problem with a diminished blood flow to the limb, or was this all a result of an immunological injury, that is some low-grade rejection going on. We are not yet sure, but it did not display the known, established, conventional, what is traditionally known as rejection in hand transplant was not displayed by Dave.